great to have everybody here. While we're waiting for a few notable people to arrive, I'm really pleased to introduce the Raging Grannies to kick us off.
Raging for Healthcare!
Yay!
Raging for Healthcare. Come on up, singers.
Health.
Okay.
And health.
And health, yes.
Health.
Healthcare. Health. Right. Long-term care.
Come and join us.
You ready? Okay, the first song is our Single Payer Act song by Rashenda and Nancy. The healthcare bills go round and round. The healthcare bills go round and round. No help for us, no end in sight. The healthcare bills go round and round, right across the nation. The healthcare bills go up, up, up. They think we're cogs and have no rights. We can't afford the higher costs all across the nation. We need a single payer act to help us to survive. We need a single payer act to keep us alive. And we need it now! Okay, thank you.
Okay, now we'll do the second one.
Okay, we're going to do our Rudolph song. Rudolph Stream, good, Corinne. By Corinne, who just got here. Okay, get ready. We're doing Rudolph.
But we're singing.
We're doing Rudolph. Ready?
Rudolph.
Rudolph the red-nosed reindeer had a painful swollen nose. He wouldn't see a doctor because he said it grows and grows. Rudolph can't pay his doctor, even with the ACA. He can't afford their health plans, and he says it's not okay. In Rudolph's dream, Christmas Day Santa appeared. He let Rudolph know insurance firms are in charge still. They make profits from your bill. Rudolph told all the people. Congress heard the people shout. We got single payer health care, and no one has to do without. Okay, thank you. Okay, we'll do one for later. Save one for later. Okay. Next.
All right, let's hear it for the Grannies. Okay, I'm pleased to introduce our next speaker, Marva Wade, registered nurse, board member of the New York State Nurses Association, one of the staunchest advocates for the New York Health Act and Medicare for All here in New York. Let's hear it for Marva.
I heard that. I take notes everywhere I go, so I have some remarks today. As you already heard, my name is Marva Wade. I am a registered nurse, and I sit on the board of directors for New York State Nurses Association. We have 42,000 members, and every one of them think that it's time that we had health care for all New Yorkers. So I'm here to speak for them. They're at work today. I am retired, so as New York nurses, we are on the front lines every day helping patients navigate this crazy and complex health system that we all try to function in. Unfortunately, many of our members are all too familiar with the failures of healthcare. Things are so broken, fragmented, and scattered. Never mind the cost of healthcare in the state of New York. So many of our patients don't get healthcare. Their cancer goes untreated. Whatever their problem is, they're afraid to go to the doctor because they can't afford it. Anybody that has diabetes knows the high cost of insulin, which is a life-saving drug. So while we know there are many factors at play in determining the health outcome of the population, One very important ingredient is reversing those shameful healthcare outcomes. We pay more for healthcare and we get less. That's absolutely not right. So what I'm here to tell you is we're ready to fight with all of you to have healthcare for every New Yorker. Every New Yorker deserves healthcare and they should get it. This So what we're doing is ensuring workers currently receiving health care benefits through our collective bargain agreements see the same or better benefits for approved Medicare for All program. For the record, NYSDA is committed to working with our brothers and sisters in labor to address any concerns they may have about Medicare for All. Legislation moves forward through the democratic process. This legislation is an economic and moral imperative, and the New York State Nurses Association is passionate about seeing it enacted into law, and we look forward to working with all of you to finally make healthcare for all a reality, because the rules should be everybody in, nobody out. Everybody in, nobody out. Thank you.
So it's a proud day for the Campaign for New York Health, a statewide coalition advocating for the New York Health Act all over New York State. Cities, towns, counties have been passing resolutions in support of this bill because we know we can provide high-quality health care for all and save everybody, including our local government's money. So the resolution today, we are so excited about this hearing and seeing it move forward to get New York City officially on record for single-payer universal health care. And I'm pleased to introduce Council Member Levine, who chairs the Health Committee and has helped usher this through. Thank you.
All right, let's see if you were paying attention. Everybody in?
Nobody out!
Everybody in?
Nobody out!
I am so thrilled to be here with this coalition, which is composed of some of the most impressive, effective, strategic organizers I have ever worked with. And I got to give a special shout out to the nurses. If you love nurses, make some noise. Thank you, NYSDA, for being here and being strong. A shout out to my colleague, el hermano mío, Rafael Espinal, who's been a huge supporter on this cause for so long. And I cannot wait to hear from the prophet of single-payer health care, Dick Gottfried, assembly member, who's going to be inside, who for decades has been leading this fight from way before it was cool. Now, I have been involved in a lot of complicated policy fights during my time in office, but I have never, ever encountered an opposition who spread so much misinformation, half-truths, scare tactics, myth-making. It is out of control. So I want to say one or two just very, very basic facts about what we are talking about today in advancing a program of universal single-payer health care for New York State, which would leave no New Yorker out, regardless of age, ability to pay, your pre-existing health, and your immigration status. This is a truly universal health care plan that would automatically provide health coverage with no deductibles, no co-pays, and no out-of-pocket costs. How does that sound? You guys like that? Does that work for you? Okay. And on the money, because my God, the misinformation on this has just been out of control. This plan would be financed by existing federal and state funding, as well as progressive graduated state taxes. And when you add it all up, the vast majority of New Yorkers would pay less than they currently do, because of the billions of dollars of inefficiencies that we can remove from the existing system. Those are the facts. And the hearing today will be focused like a laser beam on those facts, so the people of this city and this state understand that this policy is good economics. It's good for the health of the people of this state, and it is morally the right thing to do. And thanks to all of you, thanks to the people here and our allies across New York State, we are closer than ever to making this a reality. A plan which was called an impossible dream for years. We are closer than ever to making it a reality. So give all yourselves a big round of applause for that. Y finalmente, brevemente en español, porque yo sé que 2 o 3 de ustedes sí me van a entender, yo espero que sí. Estamos aquí no solamente pidiendo, sino exigiendo de que el Estado de Nueva York crea un sistema de cuidado de salud universal de pagador único, lo cual garantizaría el cuidado médico a todo neoyorquino, no importa su edad, cuánto gana, ni por supuesto, ni siquiera su estatus migratorio. Y esto se puede hacer, esto se va a hacer, no importa lo que diga ese desgraciado en la Casa Blanca y sus aliados cobardes en el Congreso. Nosotros acá en Nueva York tenemos el poder de hacer esto, el deber de hacerlo, y lo vamos a hacer juntos, y esto empieza hoy. Thank you so much. Muchísimas gracias, and let's win this. Thank you, thank you, thank you.
Yeah. Well,
All right, next up, the great Rafael Espinal. Let's get
I'm Dominican and his Spanish is better than mine. So I will not compete today. But I'm really, really excited to be here, and I really want to give a big thank you to Councilmember Levine for all of the great work he's done to push us forward, and our Speaker Cory Johnson, true champions around healthcare. But most especially to the Nurse Association for your steadfast support every single year to make this happen. Washington is failing us, and we have to lead as a city and a state. And I'm feeling very optimistic that this is our year to make this happen. And when I turn to my right and I see a new state senator who I know will support this 100% along the way, I know this is going to happen in 2019. So I stand behind you. No longer should we have to fight for our health care. We have to make sure health care is a basic human right moving forward. You know, I personally lost my mom to cancer 4 years ago, and I remember the struggle of figuring out whether she's covered or not. People are losing their lives because they're not getting adequate health care. People are losing their lives because they're not insured. And we're going to make sure we save lives moving on forward here on out. So thank you all for all the work you do. I stand behind you 100% of the way.
All right.
Thank you so much. Well, I'm very pleased that the lead sponsor of the resolution, Speaker Cory Johnson, is walking up right now. What perfect timing. And everybody in. Oh. Let's hear it for Speaker Johnson.
Hi, good to see you. A pleasure.
It's all you two. Address the crowd, and thank you for your sponsorship of this resolution.
Of course. Thank you all for being here. Who believes in universal health care? Who believes in single payer? Who believes in Medicare for all? So when you're someone, really anyone, no matter what you've gone through in your life, who's had to deal with a health-related issue, you know how difficult it is to navigate a completely backwards, screwed up healthcare system. And that's what we have right now. Yes. And that is why I am extraordinarily grateful for my colleague in government and good friend, Dick Gottfried, who has been championing this issue for years and years and years as chair of the Health Committee in the Assembly, and now in the majority, the chair of the Health Committee, Gustavo Rivera, who's going to be able to do this in the Senate. I'm really happy to be here with colleagues in government, the chair of our Health Committee, my friend Mark Levine, my good friend Councilman Rafael Espinal, and someone who I love, who's in the New York State Senate, our state senator-elect, Alessandra BIV. And I apologize. Assemblyman Reyes? Yes, I got it. Well done. It's the first time we've met, I think. Yes. And we're also joined by Assemblymember-elect from the Bronx, Reyes. So thank you for being here. And you were a nurse, weren't you? Yes. We love nurses. You are a nurse. You are a nurse. Once a nurse, always a nurse. I was dancing at the Neisner holiday party last night. So, when I was 22 years old, in October of 2004, I went in for a routine physical examination, and 3 days later, I got a phone call from my doctor telling me that I was HIV positive. And I was shocked. I was full of anxiety and fear. And 2 weeks later, I lost my job and I lost my health insurance. And I did not know what I was going to do. But I was fortunate enough that I got connected with a wonderful community health organization called Apicha, who we love, in Chinatown. And I was set up with an amazing caseworker who made sure that I got the care that I needed, that made sure that I was signed up for ADAP, the AIDS Drugs Assistance Program, and that I got connected with a doctor. But I was unable to actually get the health insurance that I needed once my income rose, because it was considered that I had a pre-existing condition because I was HIV positive. And so until the Affordable Care Act came along, I was someone who was always deemed to have a pre-existing condition and didn't have full access to the health care that I needed. I think the only real message today is that people are saying, it's going to cost too much. It's too complicated. Well, when you screw something up so much, it does get complicated. It gets complicated to change something that is totally screwed up. And so what we believe is that universal health care is a human and civil right. We believe that health insurance companies should not be the ones determining what type of care an individual should get. It should be between the doctor, the health provider, and the patient. That is what a healthcare system that is centered on real care and on patients should be about. And so I am extraordinarily excited for the New York Health Act. I'm excited that we are having this hearing today, and I'm excited that after years of it passing the Assembly with Dick Gottfried's leadership, that we are now going to have wonderful people like State Senator BIV in the Senate to help make sure it gets through the New York State Senate. It's not going to be easy. It's not going to be a smooth road, which is why we're going to need each and every one of you to go to Albany, to tell your stories, to talk about the importance of the New York Health Act, how it affects you personally, and why it is the right thing to do, why it is the moral thing to do, and why it is the progressive thing to do. So I look forward to doing that with each and every one of you, so that hopefully in just a few short months, New York State will be leading the way with universal single-payer health care in our state. I look forward to doing it with all of you. Thank you very much.
Okay, so we know that this battle is headed to Albany, and we are thrilled to have some friends going to fight for this. So without further ado, let's hear from Senator-elect Alessandra BIV.
Good afternoon, everybody.
Good afternoon.
So I first want to start by thanking the Speaker of the New York City Council for convening us here, Cory Johnson, as well as Council Member Levine, Council Member Espinal, and Assembly Member Gottfried. These are all champions of the New York Health Act, and I am just very grateful to be joined here today by everyone. I believe that healthcare is a basic human right. Woo! I have spent so many months, and quite frankly years, but in the past 11 months in this campaign that I was running, the number of people whose doors that I knocked on, who shared stories with me about the inability for themselves to pay for their medical expenses, or the concern that they were going to go bankrupt, or the concern that they had to choose between paying their mortgage or paying their health insurance, is quite frankly an atrocity. I have two personal stories that I'd love to share with you today, why this hits home for me directly, and the first one relates to long-term care. So I grew up in a family that came from very different socioeconomic backgrounds. On my mom's side, my mom's mother was not really from much money, and when she aged, she wasn't really able to age with dignity. And she went into a nursing home. It wasn't our first choice, and she lived until the age of 86. Now, those of you listening probably think, well, 86 is pretty old. Well, that's right. She did live a very long life, but towards the end of her life, she wasn't able to access long-term care. On the other side of my family, my grandfather, he lived until the age of 97, and I really attribute that to the fact that he was able to access long-term care. He was able to have people around the clock in his home with him. And so this is important. I think it's really important to be here today to have this discussion, to consider the inclusion of long-term care into the New York Health Act. And one last story before we end this. My father has Parkinson's disease, and despite having health insurance and having to take several pills every single month and have different prescriptions, he's still left with certain medications that cost one pill alone $1,400 a month. This is not a burden that we should be giving to New Yorkers. If we actually want to lead with love and empathy and compassion and be a leader of progressive values, the New York Health Act is the only choice that we have. So thank you for listening. I'm very grateful to be here, to be part of this hearing, and to be able to share my story so that we can actually push these things forward. But what's really important is that all of you who are listening and who are here today share your stories too, because we can never do this alone. It's going to take an army. But I think we can get this done, and actually I'm very excited to get this done. So thank you very much.
I am very pleased to bring up our champion in New York State from the New York State Assembly Health Committee. He missed the reference earlier that he's been fighting for single payer since before it was cool. But please welcome Assemblyman Richard Godfrey.
Well, thank you all. So, as they say, elections have consequences. And today we have majorities in both the state assembly and Senate of people who either co-sponsored or voted for or campaigned for the New York Health Act. Now, we have a governor who says he supports single payer, but he's not sure that we can, and says we should do it at the federal level. He's not sure we can do it at the state level, so we're working on persuading him. But we're in a pretty crucial, and by the way, that's a better position than 49 other governors have. So, we're at a very crucial moment. Every New Yorker should have the health care they need without facing financial obstacles and hardship. I don't know anyone who would say that they disagree with that. And yet the New York Health Act is the only plan on the table that achieves that goal. And if anybody doesn't like the New York Health Act, I think they have an obligation either to come up with another plan that meets that goal, and I haven't seen one, or admit that they're okay with millions of New Yorkers either going without health care or facing financial obstacles or hardships to get it. That's why we need the New York Health Act. That's why I am so delighted that Cory Johnson, the City Council Speaker, whose district overlaps with mine,
Rick was the first person who endorsed me and ran for City Council in 2013.
All right.
Before it was cool.
Yeah, before it was cool, yeah. So yes, one more demonstration that elections have consequences. It's terrific that Cory is sponsoring a resolution endorsing the bill, and that Mark Levine, the chair of the council's health committee, is holding today's hearing on the bill. Let's go ahead.
And joining Assemblyman Gottfried in Albany this year is newly elected Assemblymember Karina Reyes, who is a nurse, always a nurse, and ready to fight for the New York Health Act.
I'm not so good off the cuff like my more seasoned colleagues, so I have remarks. But the nurses have been saying this for decades, right? Your health is your wealth. Yes. And what's in your bank account should not determine your health. Your zip code should not determine your health. The complexion of your skin should have nothing to do with the quality of care that you receive. And unfortunately, that's the problem with U.S. healthcare. Too often, what's in your bank account, where you live, and what you look like can predict your health outcomes. And we have an opportunity to change it. And I am Karina Reyes. I'm a registered nurse in the Bronx. I am a member of the New York State Nurses. I am a newly elected member of the New York State Assembly, and I stand before you as someone who has experienced firsthand the huge and frankly dangerous disparities created by a healthcare system that puts profit over patients. I have cared for those seniors who, after working their whole lives, have to decide whether to pay for their medications or buy food. I have cared for those young women who deferred seeking medical care because they did not have health insurance, only to find out that their treatable condition is now too far progressed for treatment. And I have stood at the bedside for too many of my constituents as they take their last breath. And for me and so many healthcare providers, the New York Health Act is more than a bill or earmarkers in the budget. For us, the New York Health Act represents the many faces of the patients that we care for every day. That's right. There are those who have legitimate concerns about the implementation of such a bold initiative. But the right thing to do is not always the popular thing to do. But health and life have no price. We need to begin to treat our healthcare system as the vehicle to care for the physical and social ills of our society. And we need to fight for this like our life depends on it. Thank you so much.
Woo! One of the most important things we can do as advocates is share our personal stories, and it's not always easy to do that. But we're really grateful that Sandra Stein is able to share her story as a mother and a New Yorker about how this failing healthcare system has impacted her and her family. Come on up, Sandra. Thank you for being here.
Okay. I am Sandra Stein, and I come to you as the mother of a 9-year-old boy who desperately needs New York State to pass the New York Health Act. 7 years ago, my perfectly healthy and typically developing almost 3-year-old son woke up having a seizure. He was admitted to our neighborhood hospital, where over the next week and a half, we watched him lose his ability to walk, talk, swallow, focus his eyes, and reliably breathe. He was eventually diagnosed with an autoimmune encephalitis. About 2 months into his hospitalization, I started receiving calls from the billing office for all the doctors practicing at the hospital to ask why I kept choosing out-of-network providers. I was informed that while the hospital had a contract with our insurance company, the doctors did not. Now, in truth, I did not have a single choice over which providers saw my son while he was inpatient. He was seen by whomever happened to be on service that day. I was told that I had been sent to collections for non-payment of bills that I didn't even know I had, as I held bedside vigil for my son while he teetered for months on the border of life and death. I was told he was eligible for institutional Medicaid, but that there was no way to enroll him without me leaving him to go to the Midtown office and stand in line. I refused to leave my son's bedside while he was in such a critical state. That initial hospitalization lasted 15 continuous months between 3 different hospitals with different insurance contracts, causing more billing and payment complications. Eventually, we were discharged to provide hospital-level care at home. The fight to get everything we need to keep our son alive and to avoid bankruptcy is daily and draining. We can only use the preferred providers who have contracts with our insurance company to get everything he needs, and it's an ever-evolving list that changes with contract negotiations. Each time the insurance company discontinues a contract with providers, we are required to scramble to find new ones and to restart complicated processes of doctor's orders, prior authorizations, and insurance approvals. When my husband was changing jobs, we could not figure out how to move our son from one policy to another without threatening his life. We cannot have a single day of disruption of his critical services, and changes in insurance often necessitate changes in providers with predictable bureaucratic and implementation lag times that we cannot afford. We ended up using his COBRA benefit to keep him on the policy we had when he first got sick, and his eligibility for that expires in the coming year. We still do not know what we will do to ensure his safety, indeed his viability, during the transition to a new primary employment-based policy. While still 100% dependent for all activities of daily life, in the 7 years since the onset of his illness, my son has relearned to walk with assistance. He has developed a communication system using vocalizations, eye gaze, and his right hand. And to my utter joy as a mother, he can now eat by mouth. He goes to an amazing New York City public neighborhood school and thrives in an inclusion class. He is determined and funny, courageous and frustrated, and he outsmarts everyone who underestimates him and his comprehension based on his medical condition. My son has an upcoming surgery, a major surgery, his 12th in his short life. The day before Thanksgiving, I was informed that he might not be able to have the same surgical team that has performed 3 prior surgeries on him at the hospital that has managed his complex case for the last 7 years due to contract negotiations between the hospital and the insurance company. Shameful. I was terrified my son's care would suffer because of this, and with the staffs of both the insurance company and the surgeon's schedulers, we looked for ways to ensure his continuity of care over the next several days. The contract negotiations ultimately ended in agreement the Tuesday after Thanksgiving, and this specific crisis was averted. But what I'm describing to you here is madness. Yes. It is grueling, it is senseless, and it is organized for the profits of insurance companies and other money-motivated medical cost inflators. There is absolutely no sense in my son changing doctors, nurses, suppliers, and hospitals due to contract negotiations between profit-motivated entities or changes in insurance policies once his COBRA eligibility expires. And each change creates potential for and has actually caused mistakes and disruptions to his care, putting him through unnecessary suffering and ultimately making his care more expensive to the system as a whole. Like many diseases, our son's unpredictable illness could happen to anyone at any time. My son, my husband, and I are counting on our elected officials, both here and in Albany, to harness the political will and finally pass the New York Health Act. Thank you.
Thank you, Sandra. And again, we need to end this nightmare for New York families. I'm thrilled with the people we've been able to bring out today to speak up and speak out about the importance of making healthcare right. And we have with us Council Member Matthew Eugene to speak about what this issue means to him. Thank you so much.
Thank you very much. Thank you. Thank you. My name is Matthew Eugene, and I'm the New York City Council member representing District 40. Let me start by thanking all of you here and all the advocates, because what you are doing is the right thing. And you are doing that on behalf of all the people who are struggling to get access to medical care. And as all the speakers have said before, this is not a privilege. This is a human right. And we in government, we have the obligation to make sure that we come and we vote on this very important issue and bring the New York Health Act and other for everyone can get access to medical care. Let me say thank you also to Alessandra. Alessandra is here. When Alessandra was talking, she was talking you know, for millions of people who went to the same situation. And for those of us who had the opportunity to take care of patients, when you got somebody go to the hospital sick, not only the patient is suffering, but the whole family is suffering. It is a big burden for the family, especially if the family or the patient cannot have the opportunity to pay for the medical care. And I think this is the right thing to do. And let me say that I believe that health is the most precious gift that we receive from God. And we have the obligation in government to protect that beautiful and marvelous gift. And remember that the people who become sick, who are struggling to pay the medical care, who have to choose between paying food and paying medical bill, they are the hard-working people who work every single day to make New York City great, to make a country great. They paid their due already. It is our responsibility in government to protect them, to make sure that they're healthy. And this is the smart way, because if we don't do that, we're going to pay the consequences also. So to all of you, thank you for being here. I think this is the right thing to do. We have to continue to fight together until we get what? Healthcare. Until we get what? Healthcare. Until we get what? Healthcare. But I saw a sign saying, now it is the time. Yes. Let's say that. Now it is the time. Now it is the time. Now it is the time. Thank you very much. Thank you. Thank you.
It's true, fighting for health justice is a family affair, and today at the rally we actually have 3 generations of Bassetts, which is amazing. But I'd like to bring up the former doctor for New York City, Mary Bassett, and her mother, Priscilla Bassett, to speak about what this issue means to them. Thank you so much.
Thank you, everyone. The first thing I want to say is, isn't it wonderful to have these elected officials? I mean, given what we're facing in our nation today, I want to thank all of them. Dick Gottfried, who's led a lonely battle for single payer, now joined by all of us. My name's Mary Bassett. I'm a physician. I'm a public health advocate. Until the end of August, I was the health commissioner for New York City. And I'm very pleased to be here today. Since I was a doctor in training at Harlem Hospital 40 years ago, I have been an advocate of single-payer health care. And the reason is that it's the only way to guarantee that everyone's in and nobody's out. It's the only way. In our fragmented, for-profit system of health care, where a mother not only has to confront the terror of a sick child that Sandra Stein has described to us, but also has to fight for their ability to get care. It's just crazy, and it explains why our nation, where we comprise 5% of the world population, is consuming 50% of global health expenditure and getting the worst health outcomes of any wealthy nation. That is not sustainable. And we are seeing it reflected in the fact that our life expectancies are now beginning to go down. Now, my mother has been an advocate for single payer, and she's here to speak about the fact that seniors really know what it means to have single payer because they have Medicare, a universal entitlement. Mom, do you want to say something?
Yes.
Thank you. So if you care about health as a human right, we are all going to be here to encourage the City Council by a whopping margin to pass the resolution.
Yes.
All right, let me just say, someone earlier made a statement about fear-mongering that is progressing as this battle become sharper in the nation and in the state. And I want to say to seniors like me, I've been on Medicare for 25 years. I have seen Medicare being eaten away at the edges. It's already being hollowed out. And we have seen the Medicare Modernization Act that brought us Medicare Part D, the prescription drug bill that really was a handout to the insurance companies and did not actually forbid Medicare to negotiate prices. Of course, the New York Health Bill will overcome that. And what else? What else? What do we do about dentures? I know about that. What do we do about eyeglasses? What do we do about hearing aids? Medicare does not cover them. The New York Health Act will cover. It will strengthen Medicare for the existing beneficiaries. And wholeheartedly, ever since those discussions with my young doctor here at Harlem Hospital, I know that single payer is the way to go. And the time is now.
Yes.
Thank you.
Thank you. And one of the things that as single payer advocates we try to make sure people understand is that healthcare workers are with us, the nurses are with us, and physicians are with us. A majority of doctors have pulled in favor of a single-payer universal healthcare system. So I'm thrilled that we have the president of CIR, Committee of Interns and Residents, Dr. Jessica Edwards, to send that message home. Jessica, thank you. Thank you so much.
So I'm so honored to be here today. I'm Dr. Jessica Edwards. I am the national president for the Committee of Interns and Residents. We represent over 6,000 doctors right here in the city of New York and $15,000 nationally. I would be remiss if I did not give a special shout out to Dr. Bassett, who was one of the major contributors to why CIR is what it is in the city of New York right now. You know, as a union, CIR supports what the New York Health Act is attempting to accomplish, and that's having a single-payer healthcare system, because we have made a commitment to our patients. We also recognize that in the current state, it does not sufficiently protect the healthcare gains that CIR and other union members have done through decades of not negotiations, but we want to thank the bill sponsors, Assemblymember Gottfried and Senator Rivera, for being willing to sit down with our union leaders to devise even stronger language to ensure that union members don't lose any of our hard-fought gains. Today, we realize that most of our patients rely on healthcare insurance with unaffordable premiums, deductibles and copays, and other things that make it hard for them to access care. We want to put a stop to that. So I am very happy to be here today, and not in 2018 we shouldn't be dealing with this. And healthcare can no longer be a privilege that's handed only to those who can afford it. We all have a right to a healthy life. So I urge the City Council to recommend that union protections be incorporated into the New York Health Act, but having a single payer system is a necessity so that New Yorkers have accessibility to health care. Thank you very kindly.
And I'm thrilled to introduce Dr. Peter Mitra, the Chief Medical Officer at one of the most important healthcare providers in New York City, Callan Lord. Thank you.
Hi everyone, my name's Peter Mitra. I have been a family physician and HIV specialist in New York City for 20 years, for the last 5 as Chief Medical Officer at Callan Lord. In any civilized society, healthcare is a human right, not a luxury. Universal health care coverage for all New Yorkers, ensuring nobody is uninsured or has episodic, unstable insurance, will improve the health of the entire state. It will allow for much more effective preventative health care, and prevention is always the best strategy and is very cost effective. To this point, I just returned from the 2018 Ending the Epidemic conference in Albany, where encouraging data on new HIV infections across the state was presented. However, there remains work to be done, especially in getting PrEP, a way to prevent HIV infection through medication, to people who are disengaged from healthcare. A single-payer health system in the state would ensure that no New Yorker remains disconnected from the health system because of lack of insurance, and this will help to end the HIV epidemic. Secondly, public health measures such as vaccinations will be much more effective when everyone is connected to healthcare. In terms of cost, a single-payer health system in New York has the potential for really strong leverage in price negotiation with drug manufacturers. This is a major and disproportionately large cost to the US health system. Imagine a single payer, having one universal way of doing things across the board, from pre-authorizations for tests to coverage for medications, not the dozens of complicated different forms and delaying processes that we're stuck with today. Claims data from a single payer could enable medical providers to reduce unnecessary repeat tests for an individual bouncing from insurance to insurance, thereby not only improving patient care, but reducing costs further. Expert economists have determined that the New York Health Act will save New York billions of dollars. At Callan Lord, we pay for 100% of our employees' healthcare costs. Through lower costs and substantially reduced administrative burden of a single-payer system, we estimate we'd save $3.5 million a year, and that money could be reinvested in the really important work we're doing. The New York Health Act might not solve all of our problems, but it will go a long way towards advancing health, economic, gender, and racial equity. The fight for health equity and universal coverage through a single-payer health system is an LGBT issue. New York deserves the best, and the best is universal health care. New York is leading the country in ending the HIV epidemic. We can lead in this too. We need the New York Health Care Act.
Next up, we have a number of business owners, freelancers speaking today at the hearing, and one who will speak with us this afternoon at the rally, Dana Offenbach. Dana?
Yep. Hi all. Hi there. I know you've heard a lot, so I'm going to try and make this quick. I am not here as part of a political group. I'm not here as a religious group. I'm not here as an ethnic group. I'm here as a native New Yorker who is part of a group of over 4 million independent contractors in this city who cannot get good health care. I was raised in this city at 14 years old. I went and got my work papers. I've been paying taxes in this city since I'm 14 years old. For the last few years, I've paid more taxes than certain corporations that are based in New York, and I can't get good health care. We independent contractors, which is probably one of the largest growing groups in New York, we as independent contractors are falling through the cracks. We need help. We are now the bloodline of this city. We keep it pumping. If I worked in a corporation, I'd have great health care. If I was an elected official, I'd have great health care. But they all work for us, and we can't get great health care. So we need some help here today. That's why I'm here. Thank you, everybody.
Okay, one of our new coalition members is Disabled in Action. And Eugene Ryan is here to speak to the importance of people with disabilities to move forward on the New York Health Act. Hi,
everybody. Hi, I'm Jean Ryan. I'm president of Disabled in Action. We're a cross-disability civil rights organization founded in 1970. Long-term care and home care is a right. We're confident that long-term care of all kinds will be included in the New York Health Act because not only is it a right, it's a necessity. Thank you.
Thank you, Jean. And I'm very pleased to introduce an ally in labor, Josh Kellerman, with RWDSU. Thank you, Josh.
I'm the final speaker. All right, I have the honor of being the final speaker today. Woo! And I'm not here to talk about my personal healthcare saga, which obviously I'm going through. I'm here to talk about my union. My name is Josh Kellerman. I work for the Retail, Wholesale, and Department Store Union. And on behalf of our president, Stuart Applebaum, and 100,000 low-wage workers in the retail, grocery store, and food supply chain industries, we demand universal single-payer health care. And we demand it for two simple reasons. First, health care is a human right. And second, the current system is broken. So I'll close us out with a quick chant. What do we want? Health care! When do we want it? Now! What do we want? Health care! Oh, when do we want it? Now! What do we want? Health care! Oh, when do we want it? Now!
Thank you. Thank you, everyone, for being here. And now we've got a hearing to attend. So you can get through those doors to the committee room and look forward to continuing the show. Thank you, everyone.
Are we collecting the signs?